obviously really powerful. We're seeing kind of that first cut. It's going to be a much longer film that'll be airing on PBS, but I'm so glad to be able to share that with you today. I'm Amy Kennedy, Education Director for the Kennedy Forum, and I just want to recognize a few folks in the room before we get started. I'd love to thank first Roshan for hosting us, for helping to put this together, such an important message, and we're grateful to have sponsors today, an innovative company called Homus, who's doing great things to improve both research care for behavioral health, including building the world's largest real-world evidence database and delivering AI-powered analytic models. We also have Brightline here today, who's developed the nation's only one-stop shop for affordable evidence-based online mental health care, built specifically for children and caregivers. And in 2.5 years, they've brought leading employers and health plans like Amazon, Stanford University, Aetna, the Blues, and more to the table, partnering. And Effective School Solutions, ESS has been helping school districts implement culturally inclusive mental health and behavioral support programs for over a decade. And their services improve care, strengthen outcomes, and address trauma and empower students in their home districts. And they're all here with us today, so thank you so much for tackling this issue. I also want to just give a shout out to the other organizations who have been working on the front lines of this issue for so long. So MHA, which is here today, Schroeder, and JED Foundation, ACAP, and others, because if you're thinking about how you're going to address this when you go back to your home states, they are the partnerships that you need. JED is on campuses in every state. MHA has local affiliates all around the country, and ACAP is doing everything they can to meet the demand that we know is so desperately needed. I was a school teacher, and in my time teaching, I didn't have students that were opening up like the ones we saw. But it was really obvious that kids were struggling. So they may not have had the words, they weren't talking about it and disclosing their symptoms, but this was so clear, as it is to all educators, that there are kids in your class that are having a hard time, and the resources just weren't there. So I could see it, and at that time, I didn't always have the training to recognize that the behavior challenges I saw were a symptom of mental illness. I may have just been frustrated as a classroom teacher who saw someone in my class failing or putting their head down or having their hood up in class, or maybe other acts in class that were disruptive. And so my approach wasn't the best. But I knew that there was something going on, that if only I could figure out what to do, how to refer this student for the right services, we could change that track. Mental Health America's longtime slogan has been before stage 4. So what we're here to talk about today is stage 1. What could we do right now for these kids so that they are not on a path like the students that we saw in this film? How can we intervene early? How can we move up the treatment and interventions to where they can be really effective? So I'm so grateful to be in this fight to make things better for our nation's youth. It's given me so much hope to see states stepping up during the pandemic, adopting many of the programs and best practices. I am actually enthused and energized by this group here today. So as this movie seems like such a daunting task to take on, I know that you've all come here today thinking about the possibilities, and that we have an opportunity to reimagine what our delivery system can look like. One example is school-based telehealth that many of you were talking about just today, I think, in your meetings at the White House. We know that we're talking about building out frameworks of MTSS and what that can look like to deliver care at every level. And I'd love to call up some of the panelists that we're going to have today. We've got Bill Smith, who is the founder of Inseparable. He's a founding partner of Civitas. And Bill recently released with the Hopeful Futures campaign state report cards and policy recommendations for school-based mental health. Thanks, Bill. We also have today with us Bethany Hall-Long, Lieutenant Governor of Delaware, who's been a leading voice, who helped put this event together today, and is leading the creation of the Behavioral Health Consortium. And as chair, she's convened parents, teachers, law enforcement, providers, lawmakers, me, I've been there. We're doing this not only in Delaware, but she's leading the charge in the country. And Garlin Gilchrist, Lieutenant Governor of Michigan, who currently co-chairs the Michigan Joint Task Force on Jail and Pretrial Incarceration, helms the Coronavirus Task Force and Racial Disparities. Such an important tie-in to the work we're doing, and everywhere we go, we're talking about the work that Michigan's been doing. So we're so grateful to have you here. Oh, that's all right. All right, how's that? So I'd like to start with Bill, just to really set the framework for our discussion today. I mentioned that there was a state report card. Copies are available here, right, Bill? So we've got the state report, and that's on school-based mental health services. So we're really excited that so many of the organizations, including MHA, JED, NAMI, Trevor Project, UNICEF, all work together to create this scorecard. Maybe you could tell us a little bit, Bill, about the policies that are making a difference when it comes to school-based health, and a little background on that report card.
Sure, happy to, Amy. And first of all, God bless Amy and Patrick Kennedy for their leadership in bringing this issue front and center where it belongs.
Right here. Patrick,
You know, I will start by just saying it took my breath away in the film how much the secret and the stigma is still there on mental illness. And the reason that we took on a school report card was what Dr. Insel said in the story about how 50% of serious mental health conditions occur before the age of 14. That was true in my brother's life, and I didn't even know it. Lost him 4 years ago to suicide after a decades-long struggle that my mother only told me after he died started when he was really young. And my parents, in conversations with each other, were desperate. They didn't know where to turn. And they said, we can't take him to a psychologist. He'll be labeled for life. And so one of the things that struck me in learning about the mental health field and what families like mine, of which there are unfortunately millions all over this country who have dealt with this issue, is that we don't make it easy for people to get access to care. And so working with the Kennedy Forum and others, we said, who's doing the best work out there on school-based healthcare? Because there is some good stuff happening around the country. So working with these 18 other organizations, including our partners at MHA and JED, and I hope you get to know those folks who are in the back of the room today, we said, let's look at all the core components of what is the gold standard, what all does a school need to do? And it's things like provide access to screening tools so that we can detect if a kid is having trouble. It's school and community partnerships, because we know that kids don't just live at home, they don't just live in schools, they are in community. And so what are the effective partnerships there? But the meat of it, Amy referred to MTSS, multi-tiered systems of support, which is just a fancy term for we've got to make it where kids have somebody to talk to if they're in trouble. And so having school-based psychologists and psychiatrists and counselors available to kids when they're in trouble, to have well-being checks and to provide curriculum. You know, something that we didn't talk about when I was growing up, but there are states right now, and in the Lieutenant Governor's state right now, fantastic legislation about comprehensive education for kids to talk about this in an age-appropriate way from K through 12. So there's a lot of things that states can do. And what we wanted to do is create a toolkit, which there's a copy for all of you, for each of the lieutenant governors here, but it's also at hopefulfutures.us, where you can go and see exactly where your state's policies are on all of these issues and see recommendations and what's working in other states.
Thank you so much. Lieutenant Governor Gilchrist, first, we're going around and we're talking to states all the time, but I'm from New Jersey, so I have to say that I'm pointing to a lot of the work that's happening in Michigan when I'm telling my own state what they could be doing, and a lot of the work that's happening in Delaware. So that's, if you're wondering how we got to this conversation, it was the things like you know, having a bill that set aside funding for the technology platform that would be able to set up the records we need, or the screenings, or thinking about things like a behavioral health learning collaborative, or worrying about the ratios of counselors to students. And those are all the pieces that brought us here today. But as you're thinking ahead, we know many mental health services can be effectively provided in school settings, either on-site clinicians or through telehealth, but it's critical that schools are reimbursed for these services. Have you seen any movement around this in Michigan?
Well, first of all, just again, thank you so much for your leadership. This issue is something that we are all so much more intimately aware of than perhaps we may have been 24 months ago. I know I speak as a parent of 28-year-olds and a 2-year-old. Like, you know, parents don't like to tell their kids, I don't know. And I've said more I don't knows to my children in the last 2 years than I ever thought I would in the time that they'll be living with me. And so this is really important. And one of the things that Governor Whitmer and I have thought about are what are the barriers we need to remove to enable more care to be present with more children and more the adults who help our children. And so we have worked to reform those reimbursement rates in the state of Michigan to have a pathway for this for just frankly the care to be covered and to be compensated equitably and fairly. And we're actually going a step further in the state of Michigan now. In a budget that the governor and I just presented in the state of Michigan, we're proposing $361 million additional dollars to rapidly scale up the amount of mental and behavioral health support professionals who will be available directly in school buildings, both for young people and for the professionals who work with them every single day. And we're even going so far as to recognize that means that we'll need more professionals in the space. And so we're also working to do things like change some of the incentives to go into the profession. So at the state level, we have a state student loan reimbursement program, for example, but actually providing further incentives for people to choose this profession and to have their loans forgiven more quickly to go into this so that we can scale up the delivery of these services in school buildings. We think that'll make a big difference because school, for some children, is a place where they can sometimes feel more seen than they are at home. There may be an adult there they may be more comfortable talking to than there is in their home. They may feel safe in a different way than they do at home. And any time we can open up an opportunity for children to open up in a different way, we have a chance to serve them better.
Love that. Lieutenant Governor Long, the last 2 years have demonstrated the need for social emotional learning and supports in our schools for students. We talk about MTSS, that's that tier 1 level. And many students haven't been able to interact with peers as they normally would. Others have suffered great losses with their families. Can you talk about Delaware's efforts to do some of those life skills?
Absolutely. And to those who've stayed after lunch and listening to this, I have to start to say thank you for sharing the film and this work. I watched as each of you were touched, and many of you are lobbyists far removed in government affairs, far removed from mental health, and it was apparent. I felt it. It was palpable that these issues with children, our families, and communities pre and post COVID are critical. So we're talking children today, but thank you to you and Patrick from the Kennedy Forum for the work you've done both with adults and children. For children in Delaware, a small state, one in which I know our president is proud that we've put a lot of infrastructure over the years. It's been difficult. We have had the opportunity with Effective School Solutions and other programs, and some of them you mentioned are here today, and partners with Inseparable, Mental Health Association, and NAMI, to actually take federal dollars, and we'll probably talk a little bit more about money later, but some of our federal funding to make sure that we had services that were wraparound with children, making sure every school had a school nurse. We had mental health counselors, wellness centers, programs in place, and such that we could ensure that the children had these services. Most importantly, having been out on the streets myself during COVID in full PPE, door to door, I can tell you that the children have incredibly suffered. Many more losing their homes, many more staying with grandparents, couch surfing, suicide ideation, and the number of children who have successfully completed suicide has been tragic. And so in Delaware, we're putting those collaborative partnerships in place. We've been working with the federal government also in expressing collaborative models in our capital districts. And so anyone wants details, I can go into those later, but it is taking a village. It is really taking a lot of effort.
Bill, maybe you could tell us why we need to prioritize this: prevention, early intervention, including access to youth mental health screenings in schools, and as Delaware is pushing for in primary care. So,
yeah, Dr. Insel really said it in the film. Like, this is the place where we can get to every child in America. And you all know in your states the health disparities that exist in different communities that existed long before the pandemic. But what the pandemic did was just dial that up. And so school-based mental health gives us the chance to get to, those kids who could fall through the cracks, the kids who are in that film. But one of the reasons that we named our effort the Hopeful Futures campaign is because we think this is something that every single parent in America wants for their kid. When you talk to parents, they say, I want my kid to have a chance for a healthy, happy, hopeful life. It's the most basic thing, and sometimes I think we skim past that in these conversations. And, in my day job, before I became a mental health advocate, I spent 20 years helping to elect candidates for office. And so one of the things we did in this work is to do some polling and to do some focus groups and to go talk to people across the political spectrum. And I think it's so similar to what the Lieutenant Governor was saying from her door-to-door experience. This is something that is impacting every family in America. And if we have these conversations, we have the policy tools in place. There are so many states that are doing good things, but we've got to get in the schools because that's where we get, every kid has to be, and that's how we get them early.
And if you're wondering how your state's doing, take a look at that, because what's great about the report is it does talk about both in red states and blue states, there's progress being made. So it's around the messaging and also knowing that this is where it's going to be easiest to deliver those services during the times when kids are going to need to use some of those skills. So I have 5 kids of my own, and for many of you who are dealing with young families, the schedules are unbelievable. It's so hard. How do we get them not only to school, but to their sports, and then manage to get appointments and other things in, which we know we want to prioritize as first, right? This is the most important thing we're doing for our kids, is making sure that they are setting goals and learning how to self-regulate and looking toward the future. So what do we see in terms of Michigan? How do you pull in those partnerships that you're going to need to make this work?
So I like what you said about the fact that there's progress being made all over the country, in red states and blue states, and certainly in a state as big and diverse as Michigan. This is a unifying issue. This is an issue where I know we met with the Vice President this morning, and she has a phrase about nonpartisan problems and bipartisan solutions, and I think that's what comes to mind when we want to address these challenges here. And it starts with a recognition that everyone has a role to play. So you talked about, Lieutenant Governor, the breadth of people in this room, that we all have a stake, however, and our collective success in this effort. So we've tried to make sure we can convene, you referred to our Learning Collaborative, which is a really, it's been a groundbreaking and really eye-opening experience to see, frankly, the creativity that people are willing to lend to this effort because it is so urgent and because the stakes are so high. And so we hope that this is a model that other states can graft and make their own, so that we can really scale up again the number of institutions that see that there's something that they can do. There's a way they can invest their resources. There's a way that they can lend talent. There's a way that we can use models that may have worked in other sectors and apply them to scale up the quality and the quantity of services available to children. And the last piece I'll stress is, I think a lot about, in many realms, when we need to make sure that we're responding to the needs of children, we do have to be responsive to the needs of the adults who we charge of taking care of children and whose responsibility that is. And so I think a lot about, again, the way that we can well manage and well support the professionals who are there for our children because it is their job, the better off our children will be as well.
Absolutely. I think the burnout that people are feeling, educators are feeling, is real, because they're dealing with these challenges in their personal life and in school, and knowing that they don't necessarily have the resources ready. That feeling can paralyze you to not know how to help, or know that maybe the help isn't available. And so you're watching kids struggle. Lieutenant Governor Long, you have really been introducing, since you were in the state Senate, telehealth, before people even understood what telehealth was. You faced a lot of resistance at first, but the pandemic, of course, has increased the number of telehealth visits and made it more accessible. And I probably didn't finish that thought earlier where I was saying about scheduling, but that's one of the pieces that we know makes this easier during the daytime hours when we can access more providers. Can you talk more about the critical role of telehealth as it continues to develop, especially as a tool for our students?
Absolutely. You have to have all kinds of tools in your toolkit, right? No matter your background, your occupation, and as you had indicated with Inseparable and our incredible Lieutenant Governor of Michigan, and as I look to my other LGs who are here in the audience and who were with us earlier today, we were talking about the behavioral health spectrum and how really it's been fractured and broken, and we're all trying today focused on our children. But part of that conversation earlier with the White House was around broadband and connectivity and internet and having that accessibility, making sure you have the tools in the hands of the children, the psychologists, the wellness centers, the programs where if you are in a remote area or if you're part of an indigenous tribe or in another community where you can have access. And telehealth has been around a while. And I can remember 15 years ago when I first bringing this up, and I see some of our incredible insurance partners who are here who fully embraced telehealth now. It was a battle at first. They did not want it, which is hard to believe. Can you imagine going through COVID without telehealth? It would have been pretty difficult. And we've made that progress where it was, secure, and there was a lot of the internet connections, but we still have the broadband area that we're working on, and hopefully after ARPA, and hopefully in the next couple of years, we'll have that addressed. But telehealth is not perfect, but it is really an incredible tool to have in the toolkit, and it's affordable, and there's programs. And thank you to the insurers who are here, who are fully on board and who are participating and recognizing for that student whose parent is working 3 jobs and they can't get out, but the school counselor is willing to sit, or the school nurse is willing to sit and work with the child. It's such an important access issue because, again, having access to someone who looks like you or someone you respect, you want to tell you that having that is such an important component with psychiatric care and medicine. And finally, having appropriate, which goes to my LG colleagues, appropriate reimbursement rates in the state for telehealth, for mental health parity, which I know has been the lifeblood of the Kennedy Forum, which is parity.
Yeah, so. Thank you. Thanks for that shout out.
Yeah. Parity.
One of the things we're all talking about is, you mentioned funding. So I know Bill has a lot of thoughts on this as well. In my experience with the superintendents and others, they're thinking about how they can leverage those dollars that they got from the rescue plan for something longer term, how we can think about other funding coming in, and the grants that are available. Maybe you could talk a little bit about that and tell us what your thoughts are as far as the challenges there or an opportunity.
Well, our message to the Congress and to the administration has been states need more money for this. They need more technical assistance because for school systems to implement this, it's hard. And number 3, they need to cut the red tape on the reimbursement piece and make it easier. The good news is the fiscal year 22 budget that just passed had $111 billion in school mental health services, or $1 million rather. I wish it was $1 billion.
I thought I heard that. I was like, $1 billion. That's cool. See if you're awake. We're testing to see if they're listening.
That's right. But there are new grants that are available right now because of that budget. And so would really encourage your state Department of Education to pursue that grant money because we know it's working. States are leading on this right now, but we want to show that when the federal government makes this investment, that states know what to do with it and they're making a difference in kids' lives. But that's happening right now, and those are the mental health services professional demonstration grants and school-based mental health services grants. So that's one of the biggest ways I would say to try to access that money now.
Has your state really taken advantage of the grant programs, or?
Yeah, we have been doing grant programs, the ESSER funds, the opportunity funding. We also always, of course, not only with the federal programs, but partner with our incredible nonprofits, many of whom are here. And then also, we have to slide in, having been a legislator for years, looking at how we are maximizing some of the federal dollars also from the Medicare, Medicaid side too, because we've got to have these children who transition out, that transition period from high school into college, such an incredible time period or career aging out. So ESSER funds, opportunity funds, Medicaid, we can make a list.
That's right. Well, yeah. And Michigan's already done the state plan amendment for Medicaid, which which we know we've been talking about the language there. But what do you still see as a challenge for Michigan?
Well, I mean, at bottom, the challenge is just the scale of the problem. The reason that we keep fighting and scrapping for every single dime and every single opportunity to engage every young person is because we know that there are still people who we have not yet been able to identify and not yet been able to touch. And so because, again, of the urgency and the scale, we have to be creative. We have to, push and bend a little bit on what the guidance is and how these grant programs work. And can we kind of make it work like this to serve 200 more children in this county? Or can we, stretch a little bit here and there? The reason we do that is because we know how urgent this is. We envision a state, we envision a country where the children who are highlighted in this film, we're able to talk about those stories of success and survival and then talk about them in the past tense because children today and tomorrow are being served currently. And so we continue to see opportunities. We continue to be appreciative of the partnership and the priority that the Biden-Harris administration has put on these issues and bringing them to the fore. And we hope that, and we know that all our Democratic colleagues have certainly tried to find ways to advance this cause in their states, and we can learn a lot from one another in that.
Yeah, we heard the one counselor in there ask the kids to promise him. These kids need more than a promise. We need these resources in place because, I could not teach students about the Civil War and expect them to retain that information when those are the examples of the things that they're struggling with. Why do you think, Bill, maybe you could tell us a little on why you think tracking outcomes is going to be such an important piece of making sure that this really sticks?
Well, the good news is it works. There's a study that's about to be released that shows a 12% decrease in suicide and suicide ideation among children when we have school-based mental health programs in place. And I can't think of a better ROI for children like the 10-year-old in the film. And you know, but it's not, they're very measurable things, like when we have this many counselors and psychologists in place for kids, and we get them into screening and get them into treatment when they need it. They're very clear outcomes on that. But there's the human side of this that I think is what we've really got to talk about in terms of not just getting into the metrics and the money. There's huge savings, by the way. That, you know, corporate America is solidly behind all of this because they understand this is an investment in the next generation of the workforce. But I think we also have to be in the hope business. Because there are a lot of people out there suffering right now, and a lot of parents out there that are really scared about what's going on with their kids. And so part of this is for me to also pull back from those metrics and say, let's just talk about what every parent in America wants right now. We know they want their kids healthy. They want to be safe, and they want to be happy. This is part of how we get them there.
That's right. Maybe we could just end on that hopeful note.
Yes.
Something that you're feeling good about for going forward.
I am.
Yeah.
The bright shining of this is for those of us who've been in the trenches with behavioral health for many years. The bright light out of the horrible pandemic and the twindemic with our opioid epidemic has been the light that has been shown. The dollars, you know, recently the State of the Union had its unity agenda, the opioid crisis, the mental health crisis. I am optimistic and hopeful with the leaders in here, lieutenant governors and others who are doing wraparound services thanks to the evidence-based practice, actionable results, cost savings, and life-saving opportunities. So I was so honored to be part of your panel today, and thank you again to the Kennedy Forum and for doing this with us.
Thank you. Thank you. Last thoughts? Hopeful?
States are leading. That's the exciting thing that gives me hope. When we released the report card, we got a little bit of shrapnel from people who didn't like all their grades, which is pretty much what happens to anybody when they issue any kind of report card. But the more hopeful thing for me was leaders across the country. They're hearing this, they're taking action, they're learning from what's happening in other states, and they're in the game.
Thanks.
I guess I would leave with the fact that this is something that is solvable. We have agency. This is a problem that is scary, but it is a problem that we can and are capable of responding to. And I find that incredibly empowering, because it means that we can come together and make a set of choices and a set of investments that will make a difference and will position young people for success going forward. And all of us, that's basically our job as adults, is to position our young people to be successful. And that is something that we can do when we work together.
Thank you. Thank you
Thank
for your
you.
leadership.
Thank you.
Thank you all. That was great.